Post-deployment syndrome best describes probably the 5 key diagnoses, or a combination of concussion, which is also called a mild traumatic brain injury, post-traumatic stress disorder, which is also called post-combat stress disorder, major depression, chronic pain, and generalized anxiety disorder, GAD. Those are the 5 most common diagnoses that we're seeing as a result of the conflicts, and having 2 or more of those that are not improving is typically put into post-deployment syndrome. We typically wait a minimum of 3 months, usually 6 months before using that label, because in those separate diagnoses, you don't have general anxiety disorder unless you've had it for at least 6 months. Post-traumatic stress disorder is at least 3 months. Post-concussive syndrome from a brain injury is at least 3 months. So we don't label someone, at the get-go. It's inappropriate. It's a minimum of 3 months to see them. If you're diagnosed with post-deployment syndrome, and the typical symptoms that go with that, usually by the time that occurs, you're a minimum of 3 months after injury or after deployment, sometimes 6 months, 2 years. The further out you are, and the more diagnoses that are, or subdiagnoses that are in that pot, the more stressors you had in theater and you've had since that time are going to all weigh in to determine how well you're going to get and how long it's going to take. So if you're 3 months out and you've got 4 symptoms and two subdiagnoses and you haven't gotten well, you've got, with the right type of care, you've got a wonderful chance of near total recovery in the next 3 to 6 months. All right. However, most people aren't seen until they're hardened in terms of their symptoms. They're a year out and they've got several other things going on in their life. They've now lost their job, their benefits haven't come through yet, they've got other stressors. In that case, it's going to take significantly longer. And it's feasible, it's possible that not all of these symptoms will go away. That's another key point, is just as in the management of brain injury, the management of pain, the management of a lot of behavioral conditions, there can be some recurrence of those symptoms, or sometimes you always have some pain in your back, or you always have some thinking problems from a brain injury. The key is focus on the 95% recovery you've made, or 87%. And let's see how we can adapt your life and adapt the environment so you can go back to activity. You can go back to your family life, your social life. You can go back to work. You can go back to sleeping pretty well. It's important to give them a realistic perspective. Say, look, we're absolutely hoping for the best, but we're also going to plan this that if you don't get fully well, you're still going to be active. All right, because there's lots of folks who aren't physically 100%, who are working, who are having a great time in their life, who are playing with their kids, who are in the military, and that's a real important point as well.